Welcome to the Health Trip Podcast. My name is Jill Foose. I'm a functional medicine and integrative nutrition health coach. I created this podcast to bring you along as we travel down intriguing, science-packed roads, debunking old medical paradigms and perusing new innovative therapies and modalities with the finest functional medicine doctors, practitioners, and like-minded biohackers while living our best life. Enjoy the show. Hi, everyone. Welcome back to another episode on the Health Trip Podcast. Many women going through the menopause transition are met with adverse sexual wellness issues, from low libido to no libido, urinary incontinence, vaginal dryness, painful sex, loss of desire and arousal, the inability to achieve orgasm, and more. A woman's quality of life is greatly affected. And sexual health is a state of physical, emotional, mental, and social well-being related to sexuality. And it doesn't naturally get better as we age. It's not just going to go away one day. There are lots of options out there to help women feel sexual again. And women are living longer now. Up to a third of their life is in postmenopause. My guest today is here to help educate on the many treatments, therapies, and hormonal and non-hormonal options to support your sexual wellness goals, including lifestyle interventions. Irina Frenkel is a family nurse practitioner who has practiced functional medicine for the majority of her career. She obtained her nursing degree from Loyola University and her master's degree from DePaul University in Chicago. While teaching and working on her research in chronic disease reversal, she identified that there are alternative methods to keeping the body balanced and healthy that involve making a commitment to a healthy lifestyle. She was able to identify and help recover her own pancreatic function after a diabetes diagnosis. She has made it a mission to teach each person how their body is created and how to nurture it in the proper ways to achieve maximum health outcomes. A short medical disclaimer before we dive in. By listening to this podcast, you agree not to use this podcast as medical advice or to make any lifestyle changes to treat any medical condition in yourself or others. Consult your own physician for any medical issues that you may be having. And this entire disclaimer also applies to any one of my guests on the podcast. So sit back, open your mind, and let's dive deep into women's sexual wellness. Hi, Irina. Welcome to the Health Trip Podcast.
Hi, Jill. So great to be here. Thank you so much.
Yeah, I'm really excited to have this discussion on women's sexual health. But before we dig deep into that topic, please share with us a little bit about yourself and also share what a family nurse practitioner is as well.
Sure. So my name is Irina Frenkel. I am the director at Retreat Care Group. I'm a family nurse practitioner. So I did receive my training from DePaul University in Chicago. I am trained Western medicine originally, and then I went into traditional medicine and realized I'm not really helping anybody. So it was 2 months, and that was it for me. I went back into education and academia, started doing some research in chronic disease reversal, and realized that the best way to really help support or avoid chronic disease is lifestyle interventional medicine. And so that's kind of how I jumpstart that part of my career. And I approach health as a holistic model. And that's kind of where nurse practitioners, they resonate more with patients. They're able to create a relationship. We see patients more often. We're able to kind of meet them halfway where they're at versus the whole authority, do as I say type of model.
So when we mention women's sexual health, what are we actually talking about?
So this is such a, you got to start peeling back the layers of the onion here. And there's so many components that involve this. Outside of the whole, general things that we always think about, there's always a backstory. So when people are having symptoms of sexual health issues, meaning that they can't climax or they have vaginal dryness or they're just not in the mood. And I have so many clients that are like, I love my husband, but I haven't been with him in the last 10 years or whatever it may be. It's really we really want to get down to the root and what is the deep reasoning and the cause. And oftentimes what we're finding over and over again is stress. Women put so much onto themselves in terms of being a wife, a mother, an employee, aging parents in that menopausal age. And so there's so much on us, right? And then we're telling them, eat healthy, cook every meal, have a job, increase, thrive in your career because women are awesome. And there's so many different things that are going on. And all that just kind of takes a toll on us, and it keeps filling our cup and filling our cup until eventually we start seeing symptoms like I just don't have a libido and I have fatigue. And what we're finding is a lot of that is stemming from our adrenal glands, which are contributing to now hormonal imbalances. And then add to that menopause, which is an either further hormonal imbalance or maybe not an imbalance, completely natural, but we can help support women through that process to make sure that their diet is appropriate for this phase in their life, their lifestyle is appropriate, even to the things of how do you manage stress, how you identify values so that you can put yourself first, and what we can do to help that along so that we can support that sexual health from the root cause of where it's interrupted.
Yeah. And before we jumped on, I was actually looking at this one study from 2019 on the most frequently reported symptoms of sexual wellness issues. And here's some stats, which I thought were incredible. Low libido, 40 to 55% of the women reported. That was number one. Number two was vaginal dryness, lack of lubrication. Well, here, vaginal dryness and painful sex was 12 to 45%. And then lack of lubrication was 25 to 30%. Women are experiencing vaginal burning and itching. How about recurrent UTIs, urinary incontinence, and then pelvic floor disorders? These were all listed in this study that women, and then I want to bring to the attention that when women are in postmenopause, we still have a third of our life left. We're living longer,
Correct.
and we
Yes.
want to live a vibrant
Better.
life, better,
Yes.
vibrant,
Yes.
sexual. We want to keep it all, right? And it
For
might
sure.
look a little bit different, but I thought these numbers were pretty staggering.
Totally in line with exactly what we hear in the clinic.
Yeah.
So, there's definitely when you're a woman, you make some of those sex hormones in your adrenal gland and you make a little bit in your ovary. And during menopause, the ovary tends to atrophy. And if your adrenal gland, which is responsible for stress and your cortisol and DHEA, and if that number is not optimal and you've never been checked out, then you're going to experience a lot of these menopausal vaginal dryness. Your cholesterol is going to start skyrocketing, bone density starts to thin, you start feeling lower energy, you can't sleep as well, you're feeling more anxious over things that never really gave you those feelings in the past. And so it's so important to come in and get checked out and make sure that, not just your sex hormones. Are you in menopause? Or are you not in menopause? Or you're feeling anxious, here's an antidepressant. That is not what should be happening. I'm a huge fan of bioidentical hormones. Those are derived from a yam. They're the same basically chemical structure you had in your younger years. However, not to the same levels, of course. I'm not trying to get
Right.
you pregnant after menopause, but of course there's specific ratios that you want to maintain so that your body can be optimized. But getting down to the root is the most important. What are your adrenals doing? What is your thyroid doing? All those hormones that are linked to your vagus nerve are so important right now.
Yeah, let's break this down because there might be some listeners here who you and I are having this casual conversation about all these hormones and where they're made and then the chemical messages that it sends to other organs in the body to do specific jobs. But let's break it all down for people here. Let's start with the sex hormones, and then we're going to move into talking about why comprehensive labs are so important and how to become more of a self advocate for yourself. But let's start with estrogen, progesterone, and testosterone. What are the roles that each of these hormones play in a woman's sexual health?
Course. So estradiol, which is a test that we can get done with your doctor, and this is responsible for um, hair, skin, nails, vaginal lubrication, bone density, cholesterol levels. We've seen as estradiol comes down in the blood, cholesterol tends to start spiking. So when women are of childbearing years, your heart is protected because they have enough estrogen. And then as they enter menopause and after, we start seeing heart disease increasing significantly in those women because that estrogen is no longer there to protect. There is some data that shows that it's also protective against Alzheimer's disease, and stuff that we're still watching for. Progesterone is your hormone when you are of childbearing years, helps support implantation of the baby into your uterus. And then after you are in menopause and beyond, it's still responsible for sleep and anxiety. So in the first trimester, if you remember, and you're pregnant, you feel really, really tired. That's because you're having that progesterone surge. And so that's the same idea, but in a different number. We want that value in a specific range so that the body can sleep well through the night and not having that I'm waking up at 3 o'clock in the morning and then I'm up. And that tends to be a progesterone deficiency. Testosterone is our secret female hormone, and there's so much on this, but testosterone, in men, we know testosterone. Okay, we're not talking about men today, but we understand. For us ladies, it does need to be in a specific range. This is responsible for energy, vitality, vigor, our muscle health, our fat burning. It's responsible for our libido. And so we oftentimes see that when our adrenals are in this, what we call adrenal fatigue, they start to pull our testosterone for energy, depleting it. And people will report, I'm gaining love handles. All of a sudden I have no libido. I'm really having a crash in the second half of the day. And that's kind of where we go with that. So it's definitely important to be able to test all those hormones to see where those levels are and if that's what needs to be supported.
Yeah, and I think it's important to talk about all of these because women starting in, their 30s start heading into perimenopause and start experiencing some of these adverse side effects to the menopause transition, and they could last 7 to 15 years. I'm on the other side of it now at 56, but I can remember the massive brain fog, the low libido, the agitation and anxiety at night, the sleeplessness. It's really all encompassing, and a lot of women feel very misheard and sort of lost in the process when they go to their doctor and say, hey, something's off. I don't feel great. And I want to say that there's no one size fits all approach to supporting your hormones. Some women are candidates for HRT, which is hormone replacement therapy. And while some women might not be, some women might be candidates for some and not all. So talk a little bit about what hormone replacement therapy, how you approach hormones.
Right. So 100% true. When patients come to us, we do an initial blood work test. So we're looking at before I never put anyone on hormones right when they walk through my door.
Yeah.
That is not the intention, right? So we want to balance the body. There's a right way and a wrong way. It's really important to do a proper detox, to change dietary habits, to change lifestyle habits, because when the body's super toxic and there's a lot of visceral fat on the body, putting somebody on hormones, that visceral fat is just going to steal those hormones. They're not going to do anything. And then the risk of all sorts of malignancies increases. So it's really important to be sure that we're detoxing the body, that the toxic load is low. We're making sure that those triglycerides in the lipid panel are coming down. We do an in-body scale at the office, which tells us exactly how much body fat, because remember, toxins from the environment get stored right into that visceral fat. And so as we pull those out, those fat molecules shrink, and that's really important before starting somebody on those hormones. Additionally, it's important to make sure that their thyroid is balanced. It's important to make sure their adrenal gland is balanced. It's important to make sure their insulin levels are balanced, because these are all responsible for body to be able to go with fats. And I always say fat, and I use that almost as like a surrogate for toxicity, because that's where the toxicity gets stored. So if the body has a lot of body fat, if somebody comes in with a really elevated BMI, they're already at risk for a lot of these obesity-linked cancers, like breast cancer, ovarian cancer, endometrial, colon in women. And so it's really important that we can identify this and work on these axes. And then once we've cleansed the body, healed back the GI tract, that's so important. As we all know, there's so much going on in the microbiome. Then starting someone on bioidentical hormones is important as well. And honestly, I have people come in and they say, I have hot flashes. I'm having hot flashes all night. And we find out that they're hormonally not even in perimenopause. It's just their adrenal gland that needs support. And so sometimes, it's so important, as you mentioned, to have these comprehensive tests to really identify exactly what it is that's happening. And I've had patients been told, and they're really in their, just like as you said, in their 30s, that, hey, this is perimenopausal. And then we're finding that they've got a lot of vitamin deficiencies. We're finding that their adrenal gland is in adrenal fatigue. Once we fix that, things start to resolve. I've had a lot of people say, as I detox, my period came back. So there's a lot, still not in menopause, but even in the 30s. So there's still so much to be said about that. And there's more and more data coming out, showing how that in the right way, if done properly, bioidentical hormones could be very protective against a lot of these malignancies and osteoporosis and a lot of the stuff that we've been seeing.
Yeah, I agree with your approach, especially with younger women, because sometimes there is this hormonal imbalance going on that hasn't been uncovered yet. And when you correct that, so the hormones are like this orchestra, and as soon as one is playing out of tune, the whole orchestra is off. Right? They all play, they need to play nice together and be harmonious together. And so there's a lot of times where, especially with my younger female clients, where I'll refer them out to a functional medicine doctor, and all of a sudden we'll discover maybe they have subclinical hypothyroidism or hypothyroidism or something else going on hormonally. And when that's corrected, some of these adverse side effects that lead to this sexual wellness issue do dissipate, do go away. There's still other underlying issues going on, but you can sometimes check off some things off that list before giving actual hormone replacement therapy.
Correct, 100%. And sometimes, as you mentioned, subclinical hypothyroidism, subclinical Addison's disease, where their Addison's disease,
Yeah.
everything is normal, but their adrenals are just not working properly. So there's so much going on. And of course, this is always, like, as we said at the beginning, a multi-layered approach. There's never one thing, right? So it's always a
Yeah.
combination of everything. So it's the food you're eating, how the lifestyle you're leading. Are you sitting all day? Are you moving? Are you exercising? How's the stress management component? Are you getting any sunshine? At least 15 minutes a day. And sometimes
Mm-hmm.
area, we all know, could be a little hard. But the whole thing is, it's all, what are your relationships like? What are your values like? The mental health component is so important. And being, as we talk about sexual health, being able to openly speak with your partner about what's going on, I think is really important as well, because this is kind of like a family, it's kind of like when when you have partnership, you always want to have like these intimate, but this could be like a work in progress between yourself and your
Yeah.
partner. And I definitely think that there's so much going on here. And we've helped so many people kind of being able to have those conversations with their partner, being able to get into that mental state. But when they start with us, they're like, I have vaginal dryness. I can't have intercourse. It hurts so much, whatever the reasoning may be. And of course, using good, clean products. If you do need any kind of lubricant, these are all the types of things that we do speak with people about. So
Mhm.
just because to us, you're not along a kidney, a heart, menopause, you're a human being, and everything is connected to everything else. It's so important to know that you are the best, smartest integrative machine is the human body that's ever been created. And I say this all the time, no computer, no rocket ship can ever take the place of what is the human body.
Yeah. Yeah. Your approach is spot on, because there are a lot of women out there who might not want to even go down the path of taking hormone replacement therapy, even if they are a candidate for it. For whatever reason, that's just how their value system, their belief system, they don't want to go down that path. And so what you're doing is you're opening up the conversation to these other holistic approaches, this whole body approach to, well, let's see what else is out there. What other options are out there for you? But before we get into some of these lifestyle interventions, which I want to deep dive into, I also want to talk about the connection between insulin, estrogen, and cortisol, because as women start this perimenopausal phase in their life, moving towards menopause, a lot of things are happening um, that make it so they don't feel very sexual. One could be hair loss. One could be their skin is not looking the way it used to. One could be, which is very common among women is gaining weight around the midsection. All of a sudden, fat is being deposited in different areas on your body where it wasn't before, and it's harder and harder to get it off. And so that tends to send women down a path of changing their diet, but not in really an optimal way. It's more like, I'm going to completely reduce my calories, and then other things, there's other downstream effects of that are negative. So
For
let's
sure.
talk, how does estrogen and the decline of estrogen play a role in cortisol and insulin?
So here's what I say. These are great questions. So first off, when the body is metabolizing hormones, they metabolize through the liver. And so the liver then starts to produce LDL. And so we often see that when there's a lot of stress, if someone has adrenal fatigue or someone is going through menopause or even postpartum, right after pregnancy in the first 6 months, we notice cholesterol levels increasing. And that's because the liver, as we know, to date has 533 functions that we know of. So it's busy, it's got lots going on. And one of those is detoxifying the foods we eat, the plastics in our world, the microplastics, right? The toxins in our environment, and also those hormones. Those hormones need to metabolize somehow. And so we start seeing that. And who makes the cholesterol in the body? It's the liver. And so there's so much related to the liver. And what we're seeing a lot after the age of 50, and now even younger, unfortunately, is that fat storage deposits on the liver called fatty liver disease, which is now the number one cause for a liver transplant in the United States. And a lot of this does come from the food you eat. But a lot of people tell me, hey, I've been eating like this my whole life. Well, of course, but it takes time. It takes time to accumulate, and you've got one liver. You're throwing 400 toxins at it each day. It's going to eventually accumulate, and it's just going to not be able to do what it's supposed to do. So to answer your question, you've got all these stress hormones and menopause hormones and all sorts of stuff metabolizing through the liver, causing it to, we call cloudy, and then eventually it becomes toxic, and then it can start storing fat, and that's fatty liver, which eventually could lead to non-alcoholic cirrhosis and liver end-stage liver disease, resulting in needing a transplant. That's kind of like the path. In the fatty liver stage, it's still reversible. So it's really important with dietary changes, and it's important with the proper detox that it is reversible, and you are able to make sure that we are able to give people the tools to make sure that their liver is functioning properly, because this is vitally important, especially when and before even being placed on any bioidentical hormones. This is the first step. In terms of cortisol, remember, cortisol gets pumped through the adrenal gland when the body's under any type of stress. So it's not just I have stress at work or the kids are stressing me out. It's physical stress, it's emotional stress, it's psychological stress. The body doesn't differentiate, right? So when you're feeling so stressed, of course, those responses can contribute to heart disease, having a heart attack. There's a lot of stuff going on here. But again, that stress hormone will metabolize through the liver. And so we do see elevated cholesterol from that as well. But also we need to figure out ways to de-stress. We need to give our body tools so that it has them. And there's so many, right? What we do in functional health, we bring things back to basics. How are you pooping? How are you sleeping? How's your energy? What are you eating? What are you de-stressing? What are your relationships like? This is so important, because what's happening is we've lost sight of that. Somewhere along the way, we just completely lost sight of that, and we kind of don't even value take 10 deep breaths every hour through the day. When I tell that to to clients, people are like, really? That's all I need to do? But that activates your parasympathetic nervous system, which calms you down. And so oftentimes, and then on top of that, all those stressors, we give our body things that have a lot of chemicals in them, things that are not natural, things that are created in a factory. I don't want to say anything specific, but we all know about these things. And then the body says, okay, why are you giving me food that's stressing me out? So it's pumping more cortisol. And so when we do see that, we see immune system dysfunction and dysregulation, leading to things like autoimmunity, leading to things like fatigue, which is the number one complaint I know that functional health providers oftentimes get. We see things like belly fat storage, kind of what you're saying, around the midsection. And we see a lot of fatigue. People who are just like, after 2 o'clock, I need to eat sugar to give me that quick fix. I need to drink more coffee, which burns out the adrenals even more. So it's kind of like a vicious cycle. To bring to that point, in the talk of stress, there's recently magnesium has been getting a lot of positive research lately, if you've seen all that too. And
Yeah.
so magnesium, what I tell people, obviously you need it to absorb vitamin D, and there's so many benefits to it, but when you stress, it depletes magnesium. When magnesium's depleted, you stress, and it becomes this cycle, and you need to break the cycle. And it's, we can support you with magnesium, certainly, but while we teach you those tools
Mhm.
to allow that to happen naturally.
Yeah. Yeah. When you're in a state of chronic stress, no matter where that stress is coming from, and there are a lot of women out there who, when they're putting on weight around their midsection, all of a sudden their caloric intake goes way down and their exercise goes way up. And that is those are two uh, exogenous forms of stress on the body. And
100%.
yeah. And so your body is not going to be in a state of arousal and desire and feeling sexual. And that whole system is going to be shut down because your body thinks you're running from a tiger.
All the time. And I tell people
Right.
this, I'm not a calorie counter, never was, never will be, because 100 calories of chips and cookies is
Yeah.
not the same as 100 calories of avocados. So you cannot even, that's just not an efficient way to count what's going on in the body and how to feed the body and nourish the body. It's so important of what you're eating than how much you're eating. And if you're vigorously exercising, you need that caloric intake to be sure that you're supporting the body properly and that you're giving it all the energy that it needs to be able to break it down and build muscle. And so when you're in this caloric deficit all the time, guess what's going to happen? Your adrenal glands are going to get even more shot. And when you're constantly in these high intensity workouts, what's going to happen? It's going to shoot down your adrenal glands. And so I always tell people, especially this group that we're talking about, menopause, it's I don't want you to focus on high intensity exercise. I want you to focus on weights. Weights and plyometric exercises are so important, especially at this phase.
Well, that's really interesting that you say that, because there's a lot of research being done by some research PhDs whose main focus is midlife exercise, physiology, nutrition, and obviously and exercise. And, their recommendation is for women to, yes, number one, engage in 2, 3, 4 days a week of strength training, right? So if you're someone new to this activity, starting out with maybe 2 times a week, but really to move the dial, it's going to have to be more than 2 times a week, but also to incorporate at least 2 or 3 sessions of high intensity, 20, 30-minute workouts in that week as well. And that has been shown to also move the dial more for that midlife women's age group.
So I'm all in support of cardiovascular exercise. I definitely do think that even going on a power walk is so valuable
Yep.
because the blood is being moved and you're actually increasing your perfusion, which delivers oxygen to all your organs. And this is important. Sitting in one place definitely won't do that. But again, there's never a one size approach to everybody. And I feel like when you take these types of guidelines, it's like, well, everyone should be doing this. And it's never like that, right? Because no two people in the world are the same,
Yep.
even identical twins, right? So it's so important to know your levels, because I've had people come to me and they say, I do exactly kind of what you said. Like, I do high intensity all the time. I do weights, I work out, and I cannot lose a pound. Well, when we tested the labs, we identified there were some hormonal imbalances that were there. And once we addressed that, then the fat kind of melted away.
Yeah.
So you always want to get things at their root cause. You always want to identify where you are. And I tell people we do labs so often, and we do them at least every quarter through the year. And we tell people all the time, it's just important to know your numbers. It's almost like you're getting a report card at school so that you know where you're at and you know how to adjust your lifestyle, the food you're eating, the supplements you're taking, so that you're not overdoing it and that you're doing it correctly as you
Yeah.
move through different phases of your life.
Yeah. I want to circle back to the liver health because you were talking about that. And if people know, if they're aware that they have a genetic variant, maybe the MTHFR, which is very much connected with methylation and detoxification. Like I'm homozygous for the MTHFR, the
Mhm.
worst one, the C677one. And so I know that my detoxification in my body is really hard. Like my body struggles to do that. Is that something you look at and take into consideration in terms of someone's liver health and how optimal the liver is working?
100%. Of course, it's so important because, again, like we said, no two people are the same. And oftentimes we identify that after we do labs and interview my client, I oftentimes find that their detox pathways are clogged or they're closed and they can't sweat when they exercise because, right, sweat is one of the ways we get rid of toxins. And so we definitely customize each detox from patient to patient. There's never a one size fits all approach with us.
Also, does the conventional healthcare model look at liver function differently than a functional medical doctor?
So there's a few things, right? So as everything, you always have, you've got to take the best of both worlds. And definitely um, the levels, we're not looking at the reference range levels. Let's say you did your blood work, right? You've got the whole reference range and your doc might say everything's within normal. See you next year for your next physical. We're not really interested in that because to us, that's nothing more than a reference. And so how do those references get created? That's essentially what 95% of the population falls into. So I'm looking at different ranges. I'm looking at more functional ranges. And the reason why is because your lab values are going to look different if you're cycling, if you're postmenopausal, if you're elderly, men, women, everyone has different values. A preteen, a girl who's gotten her period, right? So there's so many different things. So I'm really looking at specific functional ranges for each demographic that I'm serving versus just, hey, you're within normal limits. Well, what does that even mean when the range is from 200 to 1200? Like that doesn't really mean anything. You know what I mean? So
Right.
we're looking at specific ranges that are specific to you because that's the whole point of individualized care. And we create those individualized care plans based on where the functional range needs to be.
Yeah, that's something that I work on with my clients a lot is how to understand what type of lab results they're looking at and the interpretation from their conventional healthcare model versus if they were to see a more functional medical doctor. And there's that normal range and the optimal range. And they'll come to me and say, my doctor said everything is in normal range. Well, but you still feel like absolute crap, right?
Yeah.
So we have to keep
Yeah.
digging, right?
Right.
There's still more to the conversation. Let's talk about some of these lifestyle interventions that you've been hinting at in terms of supporting a woman's sexual wellness journey, right? So we know now that there's this hormonal orchestra that could be out of tune, and that's something that you have to support and correct, right? You mentioned micronutrient deficiencies, which I'm huge on. That is a test that I include in all of my clients in the way I work with them to look at where are they on the spectrum of being healthy versus like functionally deficient in a specific nutrient. And that's looking at inside the cell and not really in blood circulation. So that's really important too, because we aren't eating optimally. We aren't all absorbing all of the nutrients that we eat. Some of us have a leaky gut or some type of gut dysbiosis going on, which inhibits the way our body absorbs these nutrients and utilizes them. Also, we make nutrients in our gut, right? We make nutrients, we make hormones, enzymes, neurotransmitters, all these things, right? So let's start with nutrition. Is there an optimal diet for midlife women's sexual health?
So my first answer is, right, protein, because a lot of time we are highly deficient in protein and we seem to think that eating lots of animal product is the only way to be able to get protein, and that's not always necessarily true. And different diets work for different people. Again, it's so important what symptoms are you having, because there has been data that people who have memory loss, memory lapses, especially around that menopausal time, a ketogenic diet is the way to go. And then you hear about people that have family history of heart issues. We want to be more plant-based. So there's just so many different factors, even with these really specific Alzheimer's markers, right? So there's specific groups that need to be having a high fat diet, and then there's groups that need to be having a leaner diet. So even from that standpoint, it's so important. But the reason why I really stress protein is because, and we talk about the differences between animal proteins and the quality of that protein, because that's highly important. because the animals are highly injected with all sorts of things that are not good for our gut and absorption of our food, because they do have antibiotics that they inject the animals with in the food supply. We, of course, eat those foods, and those antibiotics get transferred to us. Or even vegetables, right, that they spray with all sorts of lectins, and then we eat that. And then what happens is that our body and fertilizers, and now we've got fertilizer in our gut, which is supposed to be killing off bugs on the plants, and now it's killing off the bugs in our gut. So there's so many different things that we talk about. What is so important is we have to be mindful that we don't live in a bubble. We want to make good decisions every day, because I feel like when people get so stressed out and hung up on, oh, I can't eat that, that might have, some kind of parasite on it. And I'm not talking about like salmonella to get you sick, but
Right.
like, how
Right.
was that grown and how was that made? Of course, you should be always mindful about what we're putting in our body and how we're nourishing our body. But sometimes when you stress too much about it, I think that adds another layer of stress in that menopausal age,
Yeah.
when you're already highly stressed, right? There's so much going on. So it's always, you just want to make better choices. Like in my house, as long as we're at home, we're eating clean. I get my vegetables from a farm. I get my meat from a grass-fed, grain-fed, they do have grain-fed options, and I'm against that, because I do think that that's also highly GMO, which is not good for us. But we do get the grass-fed, grass finished meat. We get a subscription that gets shipped to us. I do have sourdough bread that's a subscription base that gets shipped to us. Everything's frozen. We make it in the oven when we want it. And so we do make those choices. But when you go out to eat, of course, you're not being served organic chicken at a restaurant. You're not being served. So you always want to be mindful, of course. And so even now, it used to be seafood is safer at restaurants. And now we're learning about how farm raised seafood is so poorly treated and fed all sorts of stuff that we're not going to talk about. But the whole thing is that you just want to be mindful, and you want to maybe allow yourself some grace, because it's so hard to be so strict and so impossible to be able to get access to some of these foods, especially here in Chicagoland area in the winter months. It's really hard to get fresh produce. It's hard to get stuff that's growing in the farm, and it does come from a truck, maybe from another state, because here we don't actually grow strawberries in the winter. We just don't.
Yeah.
And so, it's so it's hard. It's always a balance. And this is what I always tell people: you do the best that you can. As long as you're doing better today than you did yesterday, you're in the green. And so the whole point is, it's, with us here at Retreat, is small, sustainable changes. We see our clients so often, and we walk them through where those changes need to happen. And I think that's so important, because just dumping all this on someone from the start, I think becomes really hard, because then people just don't know where to begin, and they
Yeah.
don't know what needs to be a priority at that point. And so wanting, and there's nobody out there that when starting an elimination diet and removing all the junk doesn't feel better. Everybody feels better when they remove the junk. And so that's why I tell people this is where we start. And as they start feeling better, they get more motivated.
Yeah, absolutely. When you started talking about the grass-fed, wild-caught type of protein, I couldn't help but chuckle inside. I was thinking of, did you ever watch Portlandia?
Oh, no, I
Do you
haven't.
know that show? Okay, it's this
Yeah,
really funny show, and the
yeah,
show is all about these little skits. And one of the skits is the main two characters, and they're a couple, and they're at a restaurant, and they're ordering, and they're asking all kinds of crazy questions, like, was the lettuce grown on a farm where everybody was very spiritual? I mean, they went down the list with every ingredient. It was so funny. So I was like chuckling to myself on that.
yeah,
Um,
yeah.
So I give one of my corporate presentations is all about how to live healthy on a budget. And we talk about protein, right? Because we know protein is the most important macronutrient. And of course, there's people who are going to be okay with eating animals, and people who are um, more
Totally.
geared towards being a vegan, right? And
Mhm.
so I always start with, we want to optimize the protein in grams and not necessarily where it's all coming from, because it gets really overwhelming to people. And like you said, it can trigger some people to start feeling bad about themselves if they're not eating all grass-fed, wild-caught, organic produce, right? It gets really cumbersome and really overwhelming and really expensive. So I think there's two ways to approach it. If you have the funds to do all that, awesome, great. But if not, don't avoid eating the protein, because I actually had this rancher on one of my podcasts. It was one of my earlier episodes in season 1, and I buy a lot of meat from him. And his farm is a regenerative farm for cattle, and the cattle is not grass fed, grass finished. So what he was explaining to me was that the cattle, most cattle in the United States, is always starts out grass fed, and then it moves into 2 different shoots. It can either be grass finished or it's going to be grain finished. But grain finished doesn't necessarily mean they are using antibiotics. I think antibiotics are used more in poultry and other forms of animal. But so I think that it's very nuanced how these animals are raised. Personally, I don't like the taste of grass fed, grass finished, even though I
Mhm,
try to prioritize it. I don't love the taste of it. And so I always tell my clients, do the best you can, like you're saying.
mhm,
Do
mhm.
what's within your budget, because you're trying to create this path of longevity, this long sustained,
Exactly.
attainable goal for yourself. And
Mhm,
and don't let all these nuances bog you down on the bigger picture here, which is really just increasing your protein, however that is for
mhm,
some.
mhm.
Um, yeah. Did
For sure. And, just not eating the processed food. I read a study just the other day that if you take the general American, 60% of their diet comes from processed food.
yeah.
And, we hear
Yep.
this term thrown around all the time, and it's not normal it's not normal for the body. We haven't evolved. We're still in our primal, right? How our ancestors used to eat. They used to fish their own fish. They used to hunt their own cattle. They used to grow their own nuts and seeds and grains and fruits and veggies. And that's how they ate. And so now that we've industrialized so much of it, it becomes the body hasn't kept up with that, right? Your body still is still the same body that ate the your own grown fruits and vegetables 100 years ago. And so,
Yeah.
certainly we've come a long way, and thankfully we have an longer life, expectancy. We now have antibiotics, and people aren't dying from a bacterial infection, and we have a
Right.
lot of things in place. But the way that we treat our body and the way that we feed it and the way that we live definitely hasn't evolved as fast as the technology has to create a larger society, right? To be able to feed everybody, but the quality of the food is just not optimal for where we are and the way our body's created at the cellular level. And
Yeah.
so, yeah, exactly right. You just want to do the best that you can.
Yeah, yeah. So by optimizing your protein and how to connect that to a woman's sexual wellness, well, we know that when you eat more protein, you're more satiated. When you're more satiated, you're less likely to make poor choices with food in terms of snacking and processed foods. And also, protein is the one macronutrient that's going to help you change your body composition. So if you're on a weight loss journey during this midlife transition, that's going to be one of those food groups that's going to help move the dial for you. Before we get off nutrition, I want to talk about phytoestrogens, because there's still online debate over phytoestrogens and if they're healthy for women, especially while we're transitioning through menopause. So explain what phytoestrogens are and their place in a healthy diet, and why there's that controversy.
Now, in terms of phytoestrogens, things like tofu and stuff like that, that people do report that in countries that do have a more of a more plant-based diet and that do have those estrogens in their food aren't as symptomatic in their menopause because they're not having those hot flashes and they're not having a lot of those symptoms. And again, like I always say, there's no two people that are the same. It's really hard to say for sure every woman who's going through menopause should be eating this. And that's probably why the controversy that you're talking about. But I
Yeah.
definitely do think that having, and of course, people have different beliefs. And if you're a vegan, certainly tofu is a really huge protein source for you. You just want to be sure that you're getting non-GMO foods. You want to make sure that the soy is not non-GMO. That's really
Yeah.
important. But definitely having, and I always say, there's never one thing, right? There's never one thing. Like a lot of people will say, like, I'm not supposed to eat cauliflower because I have a thyroid condition. Well, then they're eating, M&Ms. So it's almost like, well, let's focus on actual food in their most natural state. And that's
Mhm.
kind of my take on that.
Yeah, yeah. So phytoestrogens are also in, a food group like
Yeah,
flax meal, right? Which is something that's great to add into your diet
yeah, and
because
I support
of the,
that.
the additional fiber. And phytoestrogens have been shown in the science. If you go to PubMed and you put in phytoestrogens, it has been shown as helpful in terms of reducing hot flashes, which is pretty cool. Let's talk about sleep. This is an area where it is very much connected to sexual wellness, right? Because if a woman is walking around chronically stressed and she's super tired, has that chronic fatigue, she's never going to be in the mood, right? There's never going to be that switch to turn on any arousal, desire, lubrication. Like it's it's not going to happen. So talk to us about sleep and hormones and what's going on there.
Yeah. So believe it or not, the body does its biggest regeneration and detoxing while you're sleeping. And so that's really, really, really important. And I always tell people that, if anybody asks me what are the two most important things to health, I would say sleep and lifting weights, right? So
Yeah.
that's kind of like my whole model. But so generally, we should be getting 7 to 8 hours of restorative sleep a night on average. Now, there's people that say I need 9 or I can't function. Great, if you can sleep 9 hours, you should sleep 9 hours. I definitely do think that around 3 4 a.m. generally, not everybody, but we do start making those, our adrenal glands are starting to wake up, human growth hormone at that time. There's a lot of stuff going on around that time period. And I do think that if we're not sleeping, we're not regenerating. So what happens, especially when we just talked about the adrenal glands, is the adrenal glands, you need to have restorative sleep. That's how they restore. And so when you're going to bed and you're not falling asleep and you're in bed and you're stressed out that you can't sleep and all of those factors, there's a lot of things racing in your head and there's a lot going on and you can't have that restorative sleep. The adrenal glands can never restore. And so it's almost like a trickle down effect, because if that happens and you're in adrenal fatigue, then right, your body's starting to pull energy from your testosterone. And when that happens, of course, libido is going to plummet. And so it's all kind of connected together. And so we can give you all the testosterone in the world, but if you're not all, but enough for a woman. But if you're not, and we can work on herbs and adaptogens and things to help support the adrenal glands. But if you're not sleeping, that's really kind of like what I say, you're running into the wind. It's almost like there's a lot of resistance that happens. And so sleep is something that we prioritize at retreat every single visit, because it's so important that you do have the sleep. And it's not just you're laying in bed looking at the ceiling, it's that you're restoratively sleeping. You're waking up restored. You go into REM, you have a dream, you wake up. And so what we do see oftentimes is in this time period in menopause, we do find that women oftentimes are not sleeping. And so they're waking up in the middle. They have got a lot of things on their mind. They've got to finish things for work. It's their only time to themselves, whatever the reasoning may be. And it could be several. But the fact of the matter is that not immediately, not skipping sleep 1 night or 2 nights or 3 nights, but it becomes a cumulative effect. And when we see that happening over and over and over again, then eventually you're going to it's just burnout. And so and to relate to sexual health, you go into this fight or flight response where you just need to survive. And so you don't want to engage in the pleasurable things that are sexual health, because you just want to survive, just to get through the day. And so by evening time, the sexual health is just not your first priority, especially knowing that after then you can't sleep, and then that can stress people out even more. So insomnia happens for many reasons, just like what we talked about, progesterone, we talked about adrenal health, we talked about a deficiency kind of in gut flora, which is so responsible to where the neurotransmitters, serotonin and GABA are made to kind of calm us
Mhm.
down so we can fall asleep and relax our muscles. Magnesium is a micronutrient that's so responsible for relaxation, and that all these things put together in a combination, then people are unable to sleep. And that's why, again, and we keep saying, get your report card, do your blood test, figure out where it is and
Mhm.
what the reasoning is.
And what about alcohol consumption and how that affects women? So many women
So
love to
many.
have a glass of wine, to wind down their day. And I get it. I understand that social aspect of having a glass of wine. I actually gave up drinking alcohol over 3 years ago. I was never a big drinker. It never, because of my homozygous MTHFR, it never made me feel good. There's nothing good that happened. So it was an easy choice for me to make. But it's a hard choice for a lot of women. But talk about the connection between alcohol and sleep, brain health, and libido.
Okay, so alcohol is a toxin. I actually read the other day somebody called it a legal toxin, and
Mm,
so certainly it does have that inhibitory pathway, right? And so from our functional health standpoint, a lot of providers recommend things like kava and stuff like that as a replacement. But what also happens additionally is the toxicity of the alcohol is so and again, cumulative effect, right? So, how much are you drinking? It's so hard to pinpoint because people, you see, have all this research. You can drink one glass of wine a night, and there's just all this stuff. But alcohol is alcohol, right? So, the whole fact is that it's a toxin. It goes into your body. It metabolizes through your liver, which then eventually leads to even more liver issues and cloudiness of the liver, and then leading to fatty liver. And so, what happens is and it slows down the brain. So when you're already going through the brain fog in that menopausal time, this just contributes to that even further. And outside of the fact that it's highly dehydrating to the body, and the body at this point is going through so much, it needs water, it needs hydration. And when you're constantly depleting it of that, their data shows that even just small dehydration amounts, right? Drinking a little bit less than you're supposed to be drinking can lead to a lot of brain fog, not being able to think straight, a lot of fatigue. And so, hydration is also something that we talk about at every single visit because it's
yeah.
vitally important. It's important for your bowels to move. Another way the body gets rid of toxins, right? So if your bowels are not moving every day, then you're holding on to toxins and you're never going to lose the weight, right? It needs to go somewhere. And that's one of those pathways. But with alcohol, it's dehydrating. It does a lot. It contributes more to what we call the leaky gut. It can contribute to brain slowness. It can contribute to liver issues, which eventually lead to inflammation in the body, right? And what is disease? Disease is essentially long-term inflammation. So we've got a lot of stuff going on from alcohol where it's not good for the body. And when you're going through these hormonal changes in a menopausal age group, definitely alcohol can make things a lot worse. People have reported a lot of hot flashes, even worse when they're drinking the alcohol. There's a lot of dehydration issues, which is huge. Sleep is not as restorative. I've had patients kind of track their sleep onto the Aura ring, and when
Yeah.
they drink, it's just not the same. And so it inhibits a lot of those pathways because remember, the body does its detoxing in the middle, while you're sleeping. And when you've got alcohol, which is a toxin, kind of taking precedent, then it needs to detox the alcohol and then all the other things that it needs to
Right.
detox your hormones and the food that you ate that day. There's just so much
Yep.
going on there.
Yep.
So definitely alcohol can have a lot of negative side effects on sleep and on your metabolism just in general.
So if one of your clients says to you, Irina, I really thought about this. I really want to get off alcohol. I want to do it. I'm done. My sexual health journey trumps drinking a glass of wine. How do you start that person? What are some of
So
those tips?
yeah. So the first question I ask is, why are you using the alcohol, right? So are they using it to wind down? Are they using it because they feel so stressed? This is the only thing that helps them. And so then they need other tools, kind of what we talked about, all
Mhm.
the micronutrients and things and what maybe the neurotransmitters, whatever that may be. So that's the first question you have to ask yourself. What are you using the alcohol for? If it's just to be social and you really don't care for the alcohol itself, and this is what I do, I ask at the restaurant for them to pour Pellegrino for me in a cocktail glass with a side of lemon and lime. And then you can be part of the group and you can toast and you
Mhm.
can do that, right? Is it social? Is it because you need it to de-stress? Are you that stressed that you need alcohol to calm you down and kind of give you that inhibition? And so that's the reason then we have other tools that we could use for that. Or is it because you think that it helps you fall asleep faster because it kind of turns off the brain and everything that's going on in
Mhm.
the brain? And then certainly you will fall asleep faster, but then the sleep is just not as restorative. And you will be, waking up in the middle of the night to run to the bathroom or whatever it is that happens in that aldosterone system when you do drink. So there's a few factors. So to answer your question, it's more, are you using the alcohol for what?
Mhm.
That's kind of where we start that conversation. And then we kind of move towards, if it's used for this reason, how do we handle that
Right. Then
answer?
you develop the strategies. I love that. Right. I always, asking what's your why with every
Yeah.
step is so important because, like you said, there's no one size fits all approach to this process, and people really need to connect with their why. Let's talk about red light therapy as we close up the conversation here. Red light therapy, we often think of it like I use a red light therapy cap for my hair loss. I talk about hair loss on my podcast and in my on social media all the time. I use a red light therapy panel for full body mitochondrial function, and obviously it does so much more than that. But now there's a whole new group of red light therapy devices for vaginal sexual wellness and health, right? And
Yeah.
so, what is your knowledge base on these devices, and
Yeah.
and do
So
they work?
So I think red light therapy. So how does red light therapy work, right? It's like
Yeah.
these long red raw infrared rays that help increase perfusion, and they help increase blood flow. So I think that's the idea, is that you insert this device into the vaginal canal to increase blood flow and to decrease inflammation in that area that could be negatively impacting that zone. So I'm super pro red light therapy on all avenues. And I know we talked about this a little bit before. And,
Yeah.
even my hairdresser uses it to kind of open the follicles in my hair, in my head, so that the hair can grow. So there's just so much benefit to it. I have an infrared sauna in my house, which, you have a runny nose, you go in there for a little bit and it clears you up. You have a sports
Mhm.
injury from the gym, you go in there, it kind of reduces inflammation. So I'm a huge fan of infrared therapy. I definitely think it's a tool. It's not an end all be all. It's not like you're going to use this tool once and all of a sudden you don't have any leakage and all of a sudden your
Right.
complete wall has been restored. Certainly there's these types of, but it is another tool in the toolbox. And some people use it and they might not like it, but they feel like, hey, if it works or it might work, I'll use it. Other people hate it and they don't want to use it. And that's okay.
Yeah.
But I think definitely it's worth trying. It's a tool. I'm very pro infrared light therapy. I think that it's a great tool. I know in Europe, there's countries that are building houses that put infrared right into the shower. So
Oh, wow.
people are kind of using it as it's just a benign, holistic measure to kind of get inflammation down, increase blood perfusion. I know they're using it in Western medicine now in oncology centers, in cardiac rehab. So there's a lot of positives to it. So that's why I'm not going to say, no, don't use that, because I definitely think that it's a holistic tool in the toolbox as well.
Yeah. So there's two out there that have some actual clinical science behind them. One is the brand Joylux, which some women might be very familiar with. And the other one is called Apex M, which is a medical device. And all of these they have been shown to treat bladder leakage, um, pelvic floor strength, um, and let's see, and then overactive bladder symptoms, and then also just um the tissue, restoring the tissue of the vagina, which as we age and as estrogen levels drop, that becomes really thin, and that's where a lot of that pain comes from. So there is science behind them. They're not woo woo, they're real, and I'll put links to those products in my show notes as well. So Irina, what a conversation, right? So
Yeah,
here we are talking about women's sexual wellness, and as you can see, it is a big story, a
for
really
sure.
big story. And it's a story that women have to be committed to, right? It encompasses your lifestyle, it encompasses doing lab work with a trusted, well-informed practitioner, whether it's in the conventional healthcare space or like yourself in the functional medical healthcare space. But it is not a quick fix. There's no one size fits all. So we've established a lot of things for people to start thinking about when they're on this journey. Any final thoughts on women's sexual wellness and what we might see coming down the pipeline in the next, 5, 10 years?
We definitely, first off, from a functional medicine standpoint, there's going to be a huge, there's a lot of providers going this route now. There's a lot of people interested in functional health and getting to the root of helping them, addressing all these issues that we talked about today. And I think that's going to be huge. I definitely do, there's always this controversy with hormones and, bioidentical versus synthetic and so forth. And so we do see bioidentical getting a lot of traction right now in the research and the research that's being done and the benefits of it. And so we are, from that standpoint, we are going to see a lot of changes in the way that we practice. Thankfully, we have a really established system in place, and I definitely would love to see more of this kind of being more mainstream. I definitely do think helping people and supporting them and empowering them with frequent office visits is definitely very beneficial. And so it really gets the results. And so that's kind of my vision for the future, is that you're asking, what do we see in the next 5, 10 years? And this is, I think, the next way.
Yeah, I love that. I love that. Well, Irina, thank you so much for joining me today. And I'm going to list all of your information, how to contact you, where to find you, so people can be aware of all these new openings that you're going to be doing throughout the country, and to be able to follow you on social media and just watch you grow and learn from you. So thank you so much again for joining us.
Thank you so much for having me. This has been lovely. And enjoy your weekend. Thank you so much.
Thank you. Thank you. Thank you for joining me. I hope you enjoyed the podcast. Lifestyle changes can be hard and overwhelming to make. By building your support team of functional medicine doctors, therapists, and health coaches, you can reach your optimal health goals. Be sure to check out my other podcasts. Until we meet again, stay healthy.